Comparing to surgery is sort of night and day. Pretty much as soon as you look at doing any kind of surgery, you're in the thousands of dollars no matter what it is, whether it's inpatient, outpatient. We've set up our pricing to start as low as $500, and the most expensive procedures we do are less than $1,200. If you look up PRP, go do a Google search, you're going to see that in places like Cleveland and Pittsburgh that it starts at $1,500 and goes up from there. And you start getting to bigger cities, I've seen numbers 5,000 and above for the same technique.
You're not put under, you're wide awake for the procedure. We just use numbing medicine to make it more comfortable. There's a little bit of discomfort during the injection. Long term, really, the complications or the side effects are very minimal with the injection therapy. It's using your own body's plasma. You're not getting a medication or a medication side effect or having an allergic reaction.
Well, I think one of the best things to think about when you're comparing and contrasting PRP injections versus surgery and trying to make that decision is understanding that once you've had surgery, the cat's out of the bag. You can't go back and undo that. You can't redo structure that's been altered surgically.
With surgery, there's cuts, there's scar tissue, there could be deformity. If everything goes well, hopefully everything lines up correctly, but it just takes a lot longer to recover. And the joints and tendons, ligaments, they're never the same once you cut them and cut into the body. If you use the PRP, you're not cutting in, you're not changing structure, you're just healing, and then everything is as it was, and hopefully will still work appropriately and much better than after changing structure with surgery.
Also, what patients are doing, and some surgeons are doing now, is they are using PRP as an adjunct to surgery, where they would do a meniscal repair and also place PRP in the joint or in the meniscus, around the meniscus during the surgical procedure, to try to help stimulate healing as well from the procedure itself. And post-surgical, it does speed up the time that that tendon heals and allows people to get back to activity sooner after surgery. After your PRP injection, you want to avoid activities, at least for the first 2 to 4 weeks. With PRP, you're trying to allow your body's own mechanisms to heal itself, and healing doesn't take overnight.
The next 2 to 4 weeks involves some gradual stretching and rehabilitation, and then after that, we move into a full rehabilitation and return to activity plan.
By 3 months, I would expect a golfer to be back golfing, doing it pretty well without any trouble. If you had surgery, you could be talking 3 to 6 months or longer before you're even considering beginning to train to return back to golf.
There are some patients that require surgery, but I think oftentimes patients head to the surgeon before they've really exhausted their non-surgical treatment options.